Hello, everyone, and welcome. My name is Olatunji Taylor. For the sake of convenience, you can call me TJ. I'm the founder of Aricares Alliance, and I'm so glad you're joining us for this important conversation, understanding Medicare's guide model. If you're caring for someone with living with dementia, you know how overwhelming the system can feel. So today, we want to bring some clarity to what the guide model is, who it is for, and how it can support both you and your loved ones. I'm joined by my co-host, Dan Williams, the owner of Elite Home Care. He works every day with families caring for loved ones at home. Dan, could you please introduce yourself?
Yes, I'm Dan Williams, Elite Home Care here in San Diego, and been in business for about 4 years now, going on 4 years. And this is a new program, and that's why we're so excited to have experts in Medicare as well as experts in additional care, which is the Guide program, and that's through these two gentlemen that are with us. Fantastic. I have Steve Wilson and Jim Robeson, and it's fantastic. And really, for me, it's also going to be something that I'll be able to learn a little more about the program. So hope you enjoy it.
Thanks, Mr. Dan. Like Dan said, we are honored to be joined by two experts. I'm Jim Robeson, the Medicare Guy. He's the president and CEO of Robeson and Associates. And also we have Steve Wilson, is a community liaison and care navigator at Nolia Health. So Jim, let's start with you. I'm curious, actually. Can you briefly introduce yourself and share why you're so passionate about helping families understand Medicare? And most importantly, why, I don't know, did you call yourself the Medicare Guy or everybody called you Medicare Guy?
Well, thank you, and I do appreciate to be on the program today, and welcome to everybody who's listening and watching. So I started the insurance business 48 years ago, but I've been specializing in Medicare for the last 10 plus years. And the way that happened was I turned 65, and I didn't know much about Medicare myself. But I realized that there were 12,000 people a day turning 65. And in San Diego County, Southern California, there were less than 1,000 brokers who could help people navigate Medicare. And I used that phrase, navigating Medicare, because it is very, very confusing. And so So I started specializing in Medicare primarily because I turned 65 at that time. And here's what I found. 6 months before you turn 65, you're going to get barraged by insurance companies and brokers and everybody else telling you or wanting you to do business with them. Well, as the Medicare guy, answer guy, I make it simple. You can throw all those things away. And the hardest part of Medicare, if those of you are watching and listening, is actually enrolling in the government plan called Original Medicare. It's the hardest part. And you do that on the Social Security website. It takes 4 to 6 weeks to get your little red, white, and blue card. And they always give you the first of the month of your birthday month, assuming you're not still working. Now, if you're still working on an employer plan, you can stay on that employer plan until you decide to retire. But for most people, they're not working. And once you transition to Medicare, Part A and Part B, A is the hospital, B is the doctor, everything outside of the hospital. There's no cost for Part A because you paid into it. In order to qualify for Medicare, you have to have worked at least 10 years or 40 quarters. So you've already paid through your FICA taxes. Part B is determined by your adjusted gross income 2 years prior. So you get your little red, white, and blue card. And here's what most people don't realize. That little red, white, and blue card allows you to go to any doctor, any hospital, any specialist, anywhere in the United States, as long as they accept Medicare. And guess what? Up to 98% of doctors, hospitals, and specialists accept that little red, white, and blue card. Total freedom. The problem is Medicare is only going to pay 80% of the bill. You're responsible for 20. So most people don't like to have a 20% financial responsibility with no limit. And they supplement that little red, white, and blue card that becomes the foundation of your health insurance once you're on Medicare with either a Medigap plan, sold by insurance companies through brokers, or a Medicare Advantage HMO plan. So those of you who are listening that are on Medicare, you probably have one or the other. And there are advantages to both of those. So that's kind of a 3-minute view of Medicare. And I think at this time, I'd like to turn it over to Steve and hear more about the GUIDE program.
All right. Thank you so much, Jim. That was really that's a lot. I mean, I think I'm ready to turn 65 now. So Steve, could you please introduce yourself to us real quick?
Yeah, so I'm Steve. Steve Wilson. I work with Nolia Health. I'm the community liaison here, so I'm responsible for the outreach and are just kind of outreach and some marketing initiatives that we have here for both states in which we operate. So we operate in California and also Washington State. And I'm also a care navigator. So what that means is that I work directly with patients and their families and their care partners. And so that's through the GUIDE model and then through other ways that we work with people. And I'm here to talk more about the GUIDE model today. Do you want me to kind of give an overview or?
Yes, please go ahead.
Okay, yeah. So the GUIDE model is a program from the Centers for Medicare and Medicaid Services. It's a new benefit for people who are living with dementia and then their care partners. And what this looks like is it's broken down into a few different components. The first one is the wraparound care. And so that is a virtual nurse practitioner visit and then visits with what's called a care navigator through the GUIDE program. Then there is the ongoing support. So that's the month. So the care navigator appointments are monthly, and then there's some ongoing, and that's in this ongoing 24/7 kind of support that's available to people. And that's like care coordination, that's in the moment, real-time help and information, resources, future planning, like those kinds of things. And then there's the respite component, which is I would say it's kind of the in-home component, because there's also an in-home safety assessment that's available to people as well. So they have an option. There's a bit of nuance in who has access to the respite hours and the in-home safety hours. But really what it is that these hours are available. It's $2,500 that's available. So that works out to be somewhere in between 60 and mid 60s and mid 70s hours, just depending on your location. And then everybody has access to this in-home safety assessment as well. And so all three of those they all kind of come together. And the purpose of this is to increase the quality of life of the person who's living with memory loss and has dementia, to decrease the burden and the stress on the care partners, the people who are caring for them, and then just broadly to help people age in place. I think that's the most important, aspect of this, is helping people age in place for longer. And as we know, dementia impacts almost 7 million people now. I mean, it's so many people. And despite this prevalence, dementia and people who are caring for someone with dementia are the most under-supported and under-resourced kind of inside the healthcare system, because of just kind of the cost and the availability. So the GUIDE model is here to help with that, and to help address that systemic issue.
Wow.
Can you add in a little bit about the link between the GUIDE and Nolia, and what it has taken you guys, years to build that relationship, and then bring it in, especially down into San Diego and California?
Yeah, absolutely. So Nolia Health is a GUIDE model provider. There are GUIDE model providers throughout the United States that are contracted with the Centers for Medicare and Medicaid, so CMS, and they provide guide model services. So it's those three components. But then in San Diego and then in California, Nolia Health is able to work with patients and get them enrolled into the guide model program. Elite Home Care is a guide model respite provider. So as most I believe all guide model providers, but at least most of them, they're all virtual. Guide is intended to be a virtual support. So there's obviously this in-home component that the virtual company can't possibly do. And so that's where the guide model respite providers come in. And that's our connection between Nolia and Elite Home Care, that Elite is one of our guide model respite providers in California, and that they are able to staff the respite cases, so the $2,500 benefit, but then also provide some support for the in-home, safety assessment, the in-home assessment as well. And that's kind of how that works. That's what that link is. Mm-hmm.
Okay, so quickly, Jim, I know that you talked a lot about, I mean, just in 3 minutes you talked about the Medicare parts A and B. So my question is that, I mean, why did Medicare feel the need to create something like Guide? I mean, is it that there was never a provision for anyone that could, become, should I say victim? I'll call it a victim of dementia and Alzheimer's in the future. Is it that Medicare never thought that people could ever need help, before coming up with this program, this new guide program?
Well, Medicare has been around for, I think, since the 1960s.
Right.
And Medicare Advantage started about 25 years ago. But, and I'd like, maybe Dan to speak to dementia. I think dementia is just, for whatever reason, blown up in the last 10 or 15 years. And Medicare is kind of catching up to, especially with this guide program, to help more of the caregivers, which are typically family members, right, Dan?
Right.
Yes.
So I don't know if that answered your question, OT, but yeah, I think they're doing everything they can. And listen, there's going to be 80 million people on Medicare. And a larger percentage of those people are going to have dementia. So I think Medicare is trying to keep their head above water. And they realize that this program, Medicare, that started years and years ago, now that they've got to somehow resource it, especially for the caregivers that are in home. The brother, the sister, the husband, the wife, all of those things. I mean, I think it's a tremendous program. I have a very dear friend that just moved into my daughter's home in Tennessee. She's got dementia, and I can see my daughter. She's got 3 kids, and she's taking care of her. And this is just like 2 or 3 weeks into moving into her home. And she actually mentioned to me there's this program called Guide. Unfortunately, our friend is on a Medicare Advantage plan, and it's not going to be available to her. So, as Steve pointed out, hopefully, as this program matures, they see that, pretty much for funding purposes, hopefully they can expand its offering to include half of the people on Medicare who are on Medicare Advantage plans.
Oh, I see that. Well, thanks so much for that. And why I asked this question was because, I had the opportunity of meeting a couple of families in the past few days, and, their loved ones had dementia and Alzheimer's, and they don't even know anything about Guide, even though they're, enrolled in Medicare. But sometimes I find Guide pamphlets on their table, but when I ask them questions about Guide, they were like, "Well, I don't know a lot about it. I'm still trying to figure it out." And that leads me to the next question. And Steve, I want to know. Let's talk about what Guide actually provide. So when a family enrolls in a Guide program, what kinds of service and supports might be available to them. And I heard you talking about your 2,500 available to them. Is it every month? Is it yearly? Is it quarterly? And how can they, use that fund efficiently or in a better way?
Yeah, I also want to speak to the Medicare piece as well. Medicare provide services to people who are on hospice, for home health, for rehab, for hospitals, for long-term care, right? But I think that dementia is just the next in line for what they're trying to provide and figure out a way to provide that support. Because people living with dementia, yes, they may fall into some of those categories, but they don't always, right? They sometimes are just at home and people are caring for them at home. And that's a good segue into what guide is trying to do. The guide model, so I'll just kind of walk you through what it looks like when somebody enrolls in the guide model and kind of how that goes, and I think it'll answer some of these questions. So when somebody enrolls, they the first thing they do is they take some biopsychosocial assessments. So that's the care partner, the person living with dementia. There's some demographic questions and assessments that they have to do, which begins a baseline for what their care care needs look like. Then they'll do a guide assessment with the nurse practitioner. So that's that virtual nurse practitioner visit that I mentioned. They'll do that assessment, and there's a bunch of questions, that CMS has come up with, and they get a baseline of people, their health, their long-term needs and goals, everything kind of related to what their care needs are. And then those two pieces of information, or those pieces of information, are sent off to CMS, and then CMS does what they call aligning them. And so they align them in the guide model program. Most people become aligned. I mean, it's a very, 97%, 99% maybe. I mean, it's only a few times they'll get, and if they get sent back, it's usually because of something that can be addressed, like they had an Advantage plan and didn't realize it or something like that. So we can assume that they'll be aligned. When they're sent back and they're aligned, they're given a guide caregiver tier. And so there's low, moderate, and high tiers. And so that's the respite benefit. So the $2,500 annual benefit is available to people who are in the moderate or high tiers. So as we know, dementia is a progressive disease. So if someone were to score in the low tier, they wouldn't get access to those hours then, but they would unfortunately probably get access to those hours in the future, because the dementia will progress and the person who's living with it, and they'll be in the moderate or high tier. That is what, and then once they're there, then they begin their ongoing support with the Care Navigator. And so that's, and I think that that's really crucial. So the monthly support for somebody, this is a place where people can ask questions, they can plan for the future, they can get additional support navigating the healthcare system, they can have a place where they can have family meetings, and a place where people can come together to discuss really important issues. That they have somebody who's just kind of in their corner, that is there to support them and be the person who kind of links everything together. And that ongoing support is something that we find pieces of it in our system. There might be a case manager here or a social worker there, but we don't really have that kind of ongoing support for people who are living with dementia, or we didn't until the guide model came along. And that's really crucial, because dementia is such a progressive disease that has these behavioral components, these cost components, it has burnout components. I mean, there's just, you couldn't possibly do everything you needed to do in one visit, right? And so that's what that monthly, and that's where that I think is so important to have that, because we do see that decreases caregiver strain, and it ultimately allows people to age in place, to remain at home for longer, do all of the things that we're hoping for them to do. And I think that the key part of that is the ongoing support paired with the respite hours that are available. You asked if they're available, annual. So they're available annually, but it's based on the guide fiscal year, which is from July 1 to June 30. So, it's and if somebody starts June 28th, they in theory have 70 hours or thereabouts to use for the next few days, and they could use them all at once. They can spread them out. They could do weekly, 4 hours here and then wait a couple weeks before I was there. They could do 3 days in a row. I mean, it just kind of depends, but there's really no parameters around that in terms of what CMS, dictates. And then they'll get all fresh new hours on July 1 and they don't have to do anything, but the clock turns July 1 and then there they go. And then they're ready to go again with those hours.
All right. And thanks so much, Stephen, for that. Dan, I think you may want to help with this one. But then I think Steve may be able to support you. I want to know, where does in-home care fit into all of this? Yes, I understand what respite care means. So, in your experience, what difference do you see when families have both a structured program like Guide and a reliable in-home care in place? And why am I asking this question? Like I said, I've had the opportunity of meeting families, and what this one of their reasons for not really thinking about the Guide was because they weren't sure. Somebody told them that, well, if they are already enrolled, with in-home care agency that does not know anything about Guide, they may not, work with another agency that is connected with Guide. I don't know how true that is. I don't know how best to answer them. So I really want to know. I need your help in this one, especially for those that are listening. What difference do you see when families have both a structured program like Guide and reliable in-home care in place? And is it possible to keep two home cares? I mean, if that's is the best way to put it, is it possible to keep two home cares, one that is not connected to Guide, and the other one that I'm already using? Does my question make sense?
Yeah. Number one, Medicare only covers home health care when you come out of the hospital.
Okay.
It doesn't cover long-term care. And that's the big hole in this whole thing. Because as Dan knows and Steve knows and everybody knows, as we get older, statistics show that we need help. So Medicare, whether it's an Advantage plan or a GAP plan or Medicare itself, only will cover if you come out of the hospital for a short period of time, home health care.
And I think that's traditionally in rehab facilities, isn't it?
Well, you can go into skilled nursing, and that's covered by Medicare and whatever health plan you have. And then you can come home and it continues for a very short period of time. The point is, it has to start with a hospital stay. You just can't have, in this case, if you don't go in the hospital and you don't need skilled nursing, but you have dementia, it's not going to be covered by Medicare. And that's the big hole where I think Guide is trying to fill in work to show that, I think everybody knows, especially CMS, they see all these numbers, that millions and millions and millions of people need this assistance.
So I'm curious now. So I want to ask Jim, is it possible that, like you said earlier, Medicare started sometimes in the 60s, am I right?
Right.
And I think another program started like 20 years ago. Was that Advantage?
The Advantage plan.
Yeah, the Advantage plan. So I want to ask, is it possible that for those that were already enrolled in Medicare for so long, can, because of the new condition, dementia and all that, is it possible by some way or by some means to kind of change their plan, to be able to be eligible for Guide, or it's all concrete?
Yeah. So that's a very good question. So if I understand the question, let's say that somebody is on Medicare and they're also on an Advantage plan.
Right.
Okay. Well, as we know, Guide is not going to, provide their services if you're on Advantage plan. And this just happened to me this week. A lady called. She's actually a client of mine. She's got a lot of, medical issues. I don't know if one of them is dementia, but she's low income. She's on an Advantage plan. Unfortunately, her doctors just pulled out of Medicare Advantage. And now she's going, I need to stay with my doctors. The only way she's going to stay with her doctors is to disenroll in the Advantage plan and go back to original Medicare. That's the only way. Now she's created this 20% financial responsibility. But if she were to do that, and I think she's made that decision because she's got to keep her doctors, she can't afford a gap plan. It's way too expensive for her. She would then, in this situation, to answer your question, you can disenroll in a health plan and go back to original Medicare. You can do that. You can only do that in most cases in, I think it's January and February. I think maybe even March, during what's called OEP, the open enrollment period. So if those that are on the webinar want to move in that direction, I'm not saying that I would recommend it, to create that 20% responsibility. I don't know. Did that answer your question?
Oh yes, please. It does, because I was thinking, I didn't know that there's a way you can just escape from
Yeah,
the
you can disenroll and go back to original Medicare in the first couple of months of each year.
All right, great. So please, for anyone that needs support, as far as disenrolling and of course enrolling in guide or whatever it is that they need to make some changes, the best person to talk to, the Medicare Guy.
Yeah.
It's always been the guy, and he will always be the guy.
Yeah.
So,
now, one more thing. If you do that,
right,
you're going to lose your prescription drug coverage. And so if you disenroll and go back to original Medicare, you also at the same time have to enroll in a standalone prescription drug plan. Otherwise, you're not going to have prescription drug coverage. Medicare does not cover prescription drugs outside of the hospital. So if you do that, make sure you also enroll in a prescription drug plan.
Oh, okay, I see that. So Dan, now that we have some understanding of how Medicare and guide works, I want to know what are the next steps. I know you're working closely with Nolia now, and you're based in San Diego. I know, like I said, I'm based in Los Angeles, and I know quite a few people that need this help. How connected are you guys? Are you only going to be servicing San Diego, or you're everywhere in California, or just a few part of California?
Well, for us, I mean, San Diego's a lot easier than taking the whole state over. But our licensing would allow us to do anything in the state of California. And I think really at this point, I'd like to ask Steve that. I mean, where has most of your contacts been? If you've been successful in Washington and now you're taking a bigger state, are there certain areas of health that you would look at as far as to say, hey, this is where we've had success before? There's people who've had a fall, or people who, have all of a sudden they're all alone. Where did the best movement back into the guide program for Nolia go?
Yeah, thank you. So Nolia, we can work with anybody in California. So that's literally anywhere in the state. And so the respite component, of course, would be a little bit more localized, like we're talking about. Dan is in Southern California and San Diego, and and there are certainly different providers that can provide services in various local areas. But the guide model program itself, and then Nolia Health, we can work with anybody who is qualified, of course, eligible in California. So there's no geographical restriction there. And if people want to get enrolled in the guide model program, they can reach out to us. That would be the best way to go about it, is to reach out to us directly, and we can start that alignment process that I mentioned earlier. Something that Jim said, is exactly, I think, where the guide model shines the most. Is people go into, they have an incident, and then they go into the hospital and come out of the hospital with home health, right, and home health care, but that's only short term, and that is probably the number one place where we find people who are both needing guide, or needing ongoing support, and then it's also just a natural transition point. I mean, so many people who are working in home health, they quickly discover there's a reason why that somebody fell. There's a reason why there was an incident, and it's because they're living with dementia. Their care partner is overwhelmed. They're in a, and we don't, dementia, people who are living with dementia are some of the highest rehospitalization cases that we have, because of all of these complex needs, the burnout, and then the behaviors and the memory. I mean, because of what the disease does and how it changes things for people. And so anybody who's on home health, I mean, that would be a really natural transition into something that's ongoing, that's a long-term support, the guide model. And then the other area that I would say is can be very helpful is anything just related to the brain and neurology, neurology clinic, maybe some sort of brain clinic, a community-based organization that specializes in Alzheimer's disease or another form of dementia or Parkinson's or something like that, where they'll have that dementia diagnosis, and they'll have people who are caring for somebody with dementia, or that they themselves are living with dementia. Those are great places for people to know about the guide model program, because that's who it's targeting. That's who it's here for. That's who it's here to support. And again, like I said, for Nolia, we can work with anybody in the state, in anywhere, and then we'll figure out the respite piece, locally, if when it comes to that. But that's no problem. We can staff respite cases anywhere as well. Yep.
Thanks, Steve. So I already see some questions coming in. Just before I go in there, I want to encourage us. I know that we are now in the age of AI. People go on, they do Google shopping. They ask, different, machines. But then experience is very important. So we have those that are in this business. I mean, they've been there for a long time. They know exactly what they're doing. They have the experience, and that is why Dan and I are trying to bring all the resources to us, so that you can ask real people the questions, and they will be able to give you real time, support. So I will encourage you to please, as much as you can, reach out to any of us. If you want a direct answer, please do not. At the end of this program, I'm going to be sharing everyone's contact, especially the Nolia and Robeson Associates. I'll be sharing their contacts. Please ask them all the questions. The only wrong question is you not asking. Like, if that's a way of putting it, just ask. I know yesterday I was in an insurance class, and the instructor actually that was the first time anyone would confess to me that insurance, especially in the United States, is really complex. So you don't want to figure this out by yourself. You need to ask those that knows. So I have a couple of questions here. Well, I'm sure you must have. I think you've answered some of them, but then I'll just ask. So Annie asked that, how do I know if my loved one might be eligible for a guide program? I'm sure we have answered that, but I don't know if Steve or Jim wants to quickly react to this before I move to the other ones.
Yeah, I'll just jump in here. So if they have a diagnosis of dementia, and if they have traditional Medicare, so parts A and B, that would be a good place to start. There's some other criteria as well, but if they have those two, then they're likely eligible for the guide model program. Or if they have a Medicare Advantage plan, then they're not eligible, and we know that. So that's another way to kind of look at it too. But that diagnosis of dementia, and then traditional Medicare, and that's all you really need to know and need to worry about. Yeah.
So Steve, the diagnosis comes from a doctor who specializes in what?
Yeah, so it'll be like a neurologist or a neuropsychologist. Some guide model providers are able to help with that. They have that ability to do that virtually. Nolia is one of them, but and some don't. Some will redirect somebody back to their primary care doctor to make a referral to a neurologist, locally in their area. So you'll just have to figure that piece out. But there might be options, even if you're somebody who's living with memory loss symptoms or concerns, or a person who has a diagnosis of mild cognitive impairment, but it's not officially dementia. I would still encourage people to reach out to a guide provider and see if they can help with that diagnostic process, because in the case of Nolia, we could, and there's a likelihood that they'd be able to help you with that. And then once you have that, then you're good to go, assuming you have traditional Medicare.
Okay.
Thanks for asking.
All right. Thanks. So the second question is there a cost to the family, especially for respite? I guess what the person is trying to say is that I guess the question is, what part is there going to be like a copay, or what parts? What part does the family have to? At what time does the family have to pay? For this program.
It's actually totally free, so there's no cost. It's a no cost benefit to people, so they don't have to pay for any of the online virtual visits with the nurse practitioner or the care navigator. That's all free. And then the respite piece, that's $2,500 that CMS provides to people who are eligible beneficiaries. And that just is something that the guide model provider and the respite provider work out behind the scenes for the care partner and for the person living with dementia. They just say, I want the benefit, I have access to the benefit, and I want it. And then it's there for them. Yep.
And that's because you guys bill Medicare?
That's because the guide program, so non-respite piece of it, it's just no cost. That's what the program is. That's for the respite piece, yes. So we get billed by the respite providers and then we bill Medicare to reimburse, basically, and they reimburse that amount. But I wouldn't think about it like that as a care partner. I just think like it's available to me and it's free. Yeah, but yep. Behind the scenes, we do some work, working out the billing part.
Thanks for your help. So somebody also asked, Evelyn was asking, what if we don't have a guide program in our area? She's talking about coverage here. Is there any problem like that?
There shouldn't be any area where there's no guide program. At least Nolia can work with everybody and everyone and throughout the state. So you should be good, because it's a virtual, everything's virtual. So the respite piece, maybe there's not a provider in a really rural area. There might be, a longer wait time to staff the respite case, but people can still get the overall guide support no matter where they are. So they could just reach out to a guide provider and they should be able to do that because it's statewide. Mm-hmm.
Oh, okay.
That's a good question, though.
Okay, so I have just two more before we go. So this one this is from Kate. Can guide help if we're already far along in the dementia journey?
Yeah, absolutely. If you're far along in the dementia journey, you would likely be eligible for the moderate or high tier, which means that you'd be eligible for those respite hours. And I'm sure that would be a great benefit, but especially the ongoing support too. Yeah, it's really for anybody, no matter where they are, whether they've been just diagnosed or they've been living with it for a decade, something like that. Yep.
Okay, thanks for that. And finally, how does this help me as a caregiver, not just my loved one?
I'll speak to that. The ongoing support is really beneficial for caregivers. It's not often that people have access to somebody who has knowledge and insights and resources and connections into something so complicated as living with dementia. And having that access monthly is almost unheard of. I mean, to have that long-term access, you just don't really get that in other programs and in other aspects of care. And that's, I think, how that would benefit care. Because, and then the second piece is those respite hours, they could be used for the caregiver to leave and go take care of themselves and get a break. Go to the movies, go shop alone, and go get coffee, go out with your friends. And I think that that's a great benefit too. It's hard to quantify those benefits until you experience it, and then then people will often say, oh my gosh, this is greatly beneficial, this is the most beneficial thing. But those two pieces of the ongoing support and then that respite support for a break, is I think that care partners will find great benefit in that. It benefits everybody.
Thanks. So what I'm hearing is that families or caregivers are not supposed to figure this out alone. So there are structures already built, like the guide model, that is beneficial to families, and all they have to do is to ask. So I'm grateful for that, and thank you so much for shedding light on these questions. But before we round up, I like Jim to give us a final wrap.
All right. I want to follow up on what Steve said in your the question. I can just imagine, and I'm thinking about my daughter. Now she's really smart and she Googles a lot, but for her to be able to pick up a phone and talk to somebody on the phone, as opposed to all this information, you got to pick up the phone and call Steve. Otherwise, it's just more and more frustration and pressure and all of that. So, one other question for Steve: can you guys give referrals to other states? I mean, if my daughter needed to in Tennessee, could we track down somebody there, or how does that work?
Why don't we chat? We'll chat offline, because I can look up and see who are guide providers in those states. We Nolia couldn't work with your daughter in this case,
Right.
or anyone in Tennessee,
Right.
of course, but we could certainly kind of direct, or help. I could help with that. Yeah, absolutely,
Right.
help direct, and at least give some names and some numbers. And I like to tell people to never Google anything related to dementia, because you're just going to see things that terrify you, and then also things that don't help you, because it's so complicated. And one of the things that case managers and care navigators in the guide program do is help people find reliable information that's vetted in those things. And in this case, I'd be happy to help. To see if I can find somebody.
And I say amen to that. So as I close, and the people who I talk to, they said, well, I found out in Google. I'm going, oh my gosh, please don't go there. It's going to confuse you. So if anybody has questions about Medicare, you can call our office at 858-935-9120. That's 858-935-9120. Or go to our website, themedicareanswerguide.com. I have some videos on there, but there's also a contact button that you can make an appointment. I'd be happy to answer your questions.
Awesome. Thanks for that, Jim. Steve, any closing remarks from you?
I would just say that, everyone asks me, will Medicare pay for that? I've been asked that question for my entire career, and I finally get to say yes. And I think that that's really cool, that this program exists for people, that Medicare will support them in this way. So I encourage people to reach out. You could give Nolia Health, you could give us a call, 855-621-0466, or you can go to our website, which is noliahealth.com, and to learn more information about getting enrolled. And I certainly encourage you to look up the guide model and take advantage of all this free stuff that's just waiting for you.
All right, thanks, Steve. Dan, can we hear from you, please?
Oh, sure. This is Dan Williams, Elite Home Care. Thank you to TJ for putting together this podcast. It's amazing how sometimes you open up and there's so much more inside than you really thought was in a small package and in a few words. So that's great. I'm happy to work with Steve at Nolia, and Jim is my Medicare guy. So it's been a wonderful time to be with you guys and share a little information for others. So thanks.
Right, thanks. And that's exactly our heart, to make sure families know what's available and feel empowered to ask for it. So thanks, Dan, James, Steve. Thank you for sharing your expertise. And to everyone watching, thank you for the care you give every day. We'll be sending follow-up information with links and resources so you can keep exploring whether, uh, exploring all the programs. And of course, so Jim and Steve and Dan has shared their contact. I'm also going to provide send you those information. And if you also Aricares Alliance, ARICARES Alliance.com, you will find Jim and Nolia and Dan's resources there just in case. I just want to make sure that you can't escape all this information. And thank you so much for joining us once again. And bye.
Bye bye. Thank you, TJ. Thanks, Jim.
Yeah, thank you. Thank you for having me.
Bye.